19, but let's bring on Dr. Hoa Nguyen of the American Medical Center Family of Clinics. Doc, good morning. Doc, good morning.
Dr.
Hey,
Nguyen.
good morning.
Oh, there you Hi, good morning,
Good
Doc.
morning. Good morning.
So let's just get right into it. I shot you a message. We hadn't heard from you in a little bit. I was like, hey, I want to catch up. So the notice went out yesterday from Department of Public Health and Social Services that commercial testing for COVID-19 would it be available at the clinics, and it said effective now. This release went out yesterday morning. I guess first question: were the clinics told that commercial testing, or were the clinics told that it was going to be announced that commercial testing was going to be available at the clinics?
We had the advisory board meeting last night, and we really asked public health, and they should not release the memo out that early because there's no discussion with the provider in the clinic regarding that the availability of the testing through DLS. We know that DLS can do it in the past, but to have the clinic to do all the tests and without talking to us on the guideline and all that kind of stuff is really not the correct way to do it. The testing is not to free people to go back to work. Testing is basically to kind of identify, isolate, and contain the virus, and it will take time, like tracing and tracking the patient. Public health right now, I don't think they have the manpower to do that, and you have to kind of work out the issue with the insurance to see who's paying for it, because it will cost a lot. We have so many phone calls yesterday to our clinic to request testing, and a lot of them are not. It's not indicated. It's like testing to be free to go back to work, which is not going to happen. Because you can test negative one day, and you go back to work the next few days, you become positive. So it's really it's very dangerous to use it without any guideline. I know Medicare, Aetna, I think Netcare are paying for it, but they still not a clear guideline when the physician are testing. We, as provider, we test it very responsible, to choose who we need to test for. But now, if this is available to DLS, we will test more. Just say if you come in, you say, I'm coughing, and you don't have a fever, more likely we're not going to test. You have to have some fever, some coughing, congestion, then we would test you, even you're 18, 20, or 60, just because we want to identify you and have the public health track you and tracing all your contact. But, a lot of people come in and say, I have a cough for 2 or 3 days or a week or so with no fever. To test all those people is really a waste of money, way of test kit, and, it will cost a lot.
Doc, what I don't understand is that aren't you on the governor's physicians advisory council?
Yes, I'm one of the member there, but like I say.
So why weren't you guys given a heads up? I mean, I'm assuming that you guys are working closely with the gov and the administration, and presumably public health, for them to shoot out a memo and to tell everyone on Guam to go to their clinic and get tested for COVID-19. Without telling you guys about it?
That's a question we asked public health last night, and I'm not sure they have an answer. We're supposed to work together, actually. We have a small group of physicians, 5 or 6 of them, that met for the first time the past few days to come up with a guideline, to come up with a subgroup that we'd like to test. And that's the right way to do it, because you want to target certain group, the old people that have to go back to work, the essential people, the healthcare worker.
Right, so this would be the group outside of the limited priority group.
Yes, this is a group outside the priority group. We have to target these people because those are people that are currently out working right now, and so and the rest of the Romanians supposed to stay at home, shelter in place, and not going out. So those not a target group that we want to target. So we come with a plan that will test a subgroup to try to isolate this virus, but that's what they need to be. But we haven't have a chance to discuss our public health yet, and they released a memo already.
Right. So, Doc, let me ask you, they released the memo yesterday. They told everyone in Guam, you can go to the clinic, you get tested for COVID-19. How many people did the American Medical Center family of clinics test for COVID-19 yesterday?
Yesterday we see over 100 people that walk in, and basically, we test very few still because, again, Christopher, if I test everybody, and remember, I have to submit the bill to the insurance company, and they might look and say, this person don't meet the criteria. The bill will come back up to you, and the question is, how much does it cost? We don't even know how much it costs. So the person we test will end up paying, $50, $80 for the test because the insurance will say, we're not paying for this. So unless the insurance come out with certain guidelines, which they supposed to, and that's their right to a certain guideline. We cannot test everybody. If you're a young person come in and you say I want an EKG done, I gotta get a certain guideline to get an EKG done for you, but we're not going to do EKG on everybody. That's not efficient.
Right. Doc, let me just play devil's advocate. If I have $50 to $80 self-pay, I want to come in and take the COVID-19 test, because there are people out there who have the means. What's going to happen to those people? If they come in, they look fine?
Chris, as a physician who has to be responsible for it, we would say no.
And what would the justification be for denying that patient that test?
That's why guidelines that we have to follow. Let's say that you have no symptom, and I test you today, and I take your money, and you are negative. And you come out and you go outside, you go to shopping, you do all kind of stuff. And the next few days, you are positive, and you potentially carry a virus there. So it gives people false sense of responsibility and security, and you go out and you infect other people. It doesn't make any sense.
Well, now that you put it that way, it makes a lot of sense.
This sounds like what's happening down at the USS Theodore Roosevelt down at Big Navy, where they're taking tests and people end up sick.
Doc, I got to ask you about that because I know you have been in the Guard, and you definitely have that military background. What is your take on this situation that's unraveling?
And I have to say, Dr. Nguyen, I remember when we went to the Philippines, and you were part of the Guam Medical Association mission, and you led our group into I can't remember where in the Philippines, but it was deep in the Philippines.
That's in Tacloban.
Yeah, Tacloban. And
Tacloban,
you set up like makeshift hospitals, a makeshift clinic, and it was amazing. So when people hear your name, they should know that you come with experience in dealing with crisis situations. Right.
So that being said, what is your take on this situation happening right here on Guam with the USS Theodore Roosevelt?
I feel for the captain. They in the ship, there's so many thousand people there in the close confinement, and it's going to spread like wildfire. I agree with him. He need to take his people off the ship and only keep certain amount of people essential for security for the ship and run the operation. But he needs to, just like he's saying in the letter, he needs to take everyone out. And I think in Guam, we gotta support them. They are our defender, and that's what our country is free for because of them. So if they sick, we're gonna take all the hospitality and make sure that they take care of them, because without them, we won't be here.
Right. Doc, but is this gonna and is there already a movement afoot for local doctors to somehow assist with the situation at the Roosevelt?
We help them the best we can. We have to get ready, just like Dr. Cabrera say. It's really, we have to be prepared because right now we feel like we way behind, and this curve will hit us like a tsunami, and we have to be prepared ourselves for the local population also.
Right. So that's what I was trying to get to is if it reaches a point where we got to mobilize a local response to assist with the Theodore Roosevelt, where does that leave the local community?
I'm sure the federal government also a planning stage. They're going to have lots of people here on the ground, and some you got to look at the other way too. If they mobilize their active duty staff and physician and nurse to come to Guam to take care of the situation, they won't leave Guam. They will stay here and help us in the local community.
Right.
So, it's a plus for us, and it's not a plus. It's just an unfortunate thing, but it's also an extra help for our physician and our staff here in Guam that they will bring these people in. I promise you they will. They will take care of the people.
Yeah, I would think that they would. We just need to get some answers from the governor, because I think it's beyond.
It's beyond. Go ask the admiral. That I can't even believe that they.
Because you saw the letter, Doc, about how they were bringing the sailors into a gym, and now
I know, yeah. And I read the letter last night, and
it was heartbreaking.
Yes, and I tell you, we have to open our island to help them. I'm telling you, after they will contain this very fast. This is the military; they move, and they have the fun to do that. And I tell you, afterward, the people that come here to take care of them will stay. They will not leave our island. They will stay behind and help our island. So we have to work with them.
Doc, having been in the military and served, what does it take for a man in a position as high up as a captain on a United States aircraft carrier to write a letter like the letter that we're seeing?
He just wanted to be transparent to our government, our people. I read the letter; it's very detailed, and I appreciate his letter a whole lot. It's nothing hiding there. They're very transparent to what they want to do.
Yeah, it's people. If you have not seen that letter, go to our Facebook page, click the link, and you could read it for yourself. And as I said earlier, they may be sailors, but they are human beings.
Right.
We have to acknowledge that. And it sounds like they need help.
They are our front line. You have to help them. I mean, as a local physician, and I'm pretty sure most of our physicians here and our staff, if we have the ability, we will come out and help them.
And there's all the talk about the U.S. Army Corps of Engineers also, and the offer that the governor talked about over the weekend to come in here, retrofit an existing facility, turn it into some sort of a COVID a hospital for COVID-affected patients. And then Dr. Cabrera also mentioned there was an offer about building, transforming a ship or a barge into a floating hospital. But then you run into, well, where are we going to get the medical staff to
staff 2,000 beds?
And maybe that's where the military might come in. I don't know.
Absolutely, Sabrina. That's what I'm saying. I mean, they come and they take care of the people, and I think their containment and their plan are very good, and they will contain this virus on their troops, and they will stay here. Absolutely, I don't think they will pick up and leave Guam behind because they're here already. That's not who they are, and that's what their job is to protect this country. And they will stay here and protect us. So we have to help them.
Okay, Doc.
I hear you, Doc.
Yeah. Anything else you want to add? I know we started this phone call talking about testing. Commercial testing is available. It turns out, I don't know, you guys are one of the biggest clinics on Guam. Do you know if other clinics are running into the same problems that you guys are running into?
SDA and FHP stood up also. And they also want a center where the urgent care and everyone can walk into to be seen there. It's take the load off GRMC and GMA, so those two clinics also stood up. So we try the best we can, but I tell you, we really like the mayor to stand up and enforce the shelter in place and ask the people to stay home. I think the majority of people kind of have a false reassurance, because I think if I look at the number of 30 tests and 9 positive or 1 positive, it's not the right curve, and we will hit that ceiling and we go up very fast.
I think what needs clarification in these numbers, especially from last night, are these 9 from the limited priority group, which are the healthcare workers, the first responders,
The elderly with symptoms.
or are they out in the community? You know what I mean? Because
Yeah, Sabrina, for everyone to test positive, assume 100 of them out there is positive. Also, we didn't test because we have a limitation of the test. So I tell you, the key here is to think.
Yes.
You gotta think. Everyone around you is positive. That's the only way you can protect them, and you have to respect that, because if you don't take care of yourself, you gotta think about your loved one, the elderly around you, your neighbor. They will not be here the next few days, the next 2 months.
And I do think about them every single day, that especially when I'm away from my son. And I don't think it's too much to ask for a little bit of transparency from the Joint Information Center, from the governor, from the military.
You got to cut them a little break, because they're coming up with hashtags and doing little cute videos when they could be getting us information.
Yes, and they're trying.
And obviously, you're the physician's advisory doctor, whatever
You guys
group,
are in the
aren't
dark.
even informed.
I mean, you guys are the governor's physician's advisory group, and they're not even telling you guys anything.
There's some mistake here and then, but we try our best to do that. But like I say,
You got to do better, Doc. People are relying on you guys.
We're pushing out the best we can. The governor has the very hard decision.
But she does not make decisions without advice. That's why you guys are there. You're the physician's advisory group.
So are you guys advising the governor, or is it like her political people advising her?
No. We advise the governor, and she take our advice, the one that she wants to implement, and she has to weigh plus and minus for different reasons.
Right.
So we recommend something, and it's up to her to accept it or not accept it. We can't tell her hey, you have to do this. We just advisory group, which is to tell her that, hey, this is the best to do this, and she has to make a decision of follow our advice or not. So, but again, please, mayor, enforce and help your village and kind of lock down and encourage people to stay home. People wash their hands, wear the mask. We still see a lot of patients that walk in, just a few that have no mask. Wear a bandana or whatever, but you gotta cover your face wherever you go. So that's the thing that I say. But you gotta pretend like everyone around you that's standing next to you have COVID-19, and we will get through with this.
Thank you, Doc.
You're welcome.
Thank you for everything you're doing.
Right on, Doc.
Keep
Hang
on
in there.
advising.
Yeah.
Okay, thank you. Have a good day, guys.
Wash your hands.
Okay, bye. Thank you.
Okay.
I am.
Okay.
Okay, bye.
Thank you.
All right.
Bye.
We got to take a break.
Yeah, we do got to take a break. And, the comments are blowing up. It's the first of the month. Rent, I got that grace period till the 5th. But this is what people are thinking about right now. And I want to go into the weeds a little bit on this because this is a question that, a few different media asked at the press conference yesterday. And so we're going to kind of look at what the governor had to say about it and read some of those comments out there. There was a comment here. Somebody had put, "We got to eat." And that's the reality. I mean, want to thank again Guam DOE for the grab-and-go meals. We'll have info about that coming up. But let's do news at 7:34. Containing COVID.